and Dr. Rumnapa Rusha will read the blessing poetry.
Suam chi pranot nom Anchali พระบรมราชินีศรีพิสัยเบญจมหาราชจอมพระทัยถวายไทยประกาศพระกิตติคุณสมเด็จพระศรีพัชรินทราพระเมตตาล้ำเหลือทรงเกื้อหนุนทรงก่อกิจสร้างสรรค์อนันตคุณด้วยรอยบุญราชและรัฐจึงพัฒนาด้วยพระปรีชาญาณเห็นการไกลดำริให้สนับสนุนการศึกษาสร้างโรงเรียนเพื่อกุลบุตรกุลธิดาสร้างปัญญาพัฒนาประชาชนทรงก่อตั้งสภากาชาดสยามสร้างอารามบำเพ็ญพระราชกุศลสร้างโรงพยาบาลรักษาประชาชนผู้ทุกข์ทนปลอดภัยไร้โรคาทรงก่อตั้งโรงเรียนหญิงแพทย์พดุงครรภ์บัดนี้นั้นโดดเด่นเป็นสง่าพยาบาลศาสตร์ฟูเฟืองเรืองวิชาเจริญมา123 ปีพระเกียรติคุณมากมายหลายสถานพระทรงงานโลกประจักษ์สมศักดิ์ศรียูเนสโกถวายพระเกียรติสดุดีพระเทวีเป็นบุคคลที่สำคัญพระกรุณามากล้ำสุดพันนาเหล่าปวงข้าอภิวาทพระจอมขวัญน้อมรำลึกสำนึกพระคุณอเนกอนันต์ขอสืบสานพระปณิธานนิรันดร์เทินด้วยเกล้าด้วยกระหม่อมขอเดชะข้าพระพุทธเจ้าคณะพยาบาลศาสตร์มหาวิทยาลัยมหิดล
Chancellor, Mahidol University Council, President of Thailand Nursing and Midwifery Council, Acting President of Mahidol University, on behalf of Faculty of Nursing, Mahidol University, I would like to extend a very hearty thank you for coming to our opening ceremony of the International Conference N-nergizing Nursing Profession for NCD Challenges or N3 Nursing Conference. Let me briefly introduce the conference. The evidence is clear that the epidemic of NCDs is draining health system budgets. Both rich and poor countries are facing common challenges on NCD and nursing. A strong focus on frontline service has been recognized as a key step for NCD response. Nurses usually act as frontline caring for, advocating for, educating and guiding communities to better health. Therefore, nursing professions are major inevitable determinants for the system transformation to handle NCD challenges Faculty of Nursing, in collaboration with Division of Nursing, Faculty of Medicine, Siriraj Hospital, Mahidol University, and the Siriraj Nurse Alumni Association, the royal patronage of Her Royal Highness, Princess Mother, has hosted this international conference. The goals are to boost up capacity of nursing professionals on NCD care, promote participatory process in addressing major gaps and challenges on NCD, as well as develop and strengthen our collaboration across institutions to better address NCD and other public health challenges. This conference has been supported by our generous institutes, including World Health Organization, Mahidol University, and Department of Disease Control, Ministry of Public Health, Thailand. Great appreciation goes to 18 co-hosts for making this N3 Nursing Conference possible. The 3-day conference gathers 575 participants from 19 countries, making NCDs a global platform to share knowledge and discuss recent advancements in the field of NCD care. The N3 Nursing Conference also offered high-quality keynote speakers, a variety of scientific sessions, poster session, symposium, marketplace, and a great networking opportunity to all participants. There are several oral and poster presentations by more than 100 young researchers and graduate students. We hope that this knowledge and experience sharing during this 3 days can lead to cross-fertilization learning across individuals, institutions, and countries. Furthermore, networking, partnership, and knowledge management can be a cost-effective means to boost up collective capacity and collaboration. On this occasion, I would like to invite Professor Bajong Mahaisawarya, Acting President of Mahidol University, to deliver welcome speech. Professor Bajong, please.
Professor yะสกล tยาทร Chancellor of Mahidol University Council, Chairman, President of Thailand Nursing and Midwifery Council, Associate Professor Kasna Buntong, WHO representative from Thailand, Chair of Organizing Committee, distinguished guests, ladies and gentlemen. It is my honor to be here today in this official opening ceremony for the International Conference, N-nergizing Nursing Profession on NCD Challenges or N3 Nursing Conference. It gives me great pleasure to extend to you all a very warm welcome on behalf of Mahidol University, Thailand. Thank you to each and every one of you for being here with us today. I am pleased to see many leaders here from across the region, along with representatives from the World Health Organization in Southeast Asia region. I would like to thank also Faculty of Nursing, Mahidol University, the Siriraj Nurse Alumni Association, the loyal patronage of Her Royal Highness, the Princess Mothers and Divisions of Nursing, Siriraj Hospital, Faculty of Medicine, for hosting this very important meeting today. As we know that NCD epidemic constitutes a major socio-economic development challenges in the 21st century, as it hampers health and well-being as well as economic at individual and macro levels. As leading cause of morbidities and mortality, NCD poses major detrimental effects on human assets and high healthcare costs to any society, as well as workload and financial burden to healthcare system. Attempts have been made to reduce premature mortality from non-communicable disease through prevention and treatment and promote mental health and well-being. Making an impact on NCD outcome would require a well-coordinated response throughout the healthcare system. Nurses act as on-care service. Responders to complex healthcare systems demand the best communicators and coordinators within healthcare teams. They are major and inevitable determinant for the system transformation to handle NCD challenges. I am pleased that this conference will be the venue for the regional meeting of nursing professionals to fight against NCDs. This N3 nursing conference is an opportunity to revisit, taking stock of knowledge and experience available, and brainstorming for the way forward to strengthen nursing professionals to address NCD crisis. On behalf of Mahidol University, I sincerely hope that you will enjoy this conference and receiving fruitful information and being happy and feel comfortable for staying with us here in Bangkok. And I hope the success of this conference. And please be pleasant stay in Bangkok. Thank you.
Thank you very much, for the warm welcome address. Next, may I please invite Associate Professor Dr. Thasana Buntong, the President of Thailand Nursing and Midwifery Council, to deliver welcome address, please.
Your Excellency, the former Minister of the Ministry of Public Health, Professor Dr. Yะสกล, currently he is the Chancellor of Mahidol University, the President of Mahidol University, and Dr. Darlene Cortez, the WHO representative to Thailand, distinguished guests, ladies and gentlemen, good morning, everyone. On behalf of Thailand Nursing and Midwifery Council, it is my great pleasure to welcome all of you to the N-nergizing Nursing Profession for NCD Challenges, organized by the Faculty of Nursing, Mahidol University, Division of Nursing, Faculty of Medicine, Sirat Hospital, also Mahidol University, and the Sirat Nurses Alumni Association, the Royal Patronates of Her Royal Highness, the Princess Mother. I would like to thank everyone, especially our friends from abroad, for participating in this very significant conference. Non-communicable disease, NCD, represent the leading cause of death worldwide, killing 41 million people each year, for equivalent to 71% of all deaths globally. In Thailand alone, NCD are estimated to account for 74% of all deaths. Attempts have been made for reducing the premature NCD death by 2030 through prevention and treatment of NCD and the promotion of mental health and well-being. Nurses are recognized as the backbone of the health system. Nurses play a key role in health for all. Everyone, everywhere nurses can lead in WHO baseline interventions for NCD, which include the reduction of harmful alcohol and tobacco use, unhealthy diet, and physical inactivity, and in the management of cardiovascular disease, diabetes, cancer, and stress. Research has demonstrated that nurses are effective in empowering people to do self-care and self-management, and in supporting individuals who are at risk of being diagnosed of NCD to change the lifestyle and behavior and administering NCD's management programs. However, nurses are recognized as the backbone of the healthcare system. Nurses play key roles in health for all. Everyone, everywhere, nurses can lead in the WHO baseline interventions for the NCD, which include the reduction of harmful alcohol and tobacco use, unhealthy diet, and physical inactivity, and in the management of the cardiovascular disease, diabetes, cancer, and stress. Research has demonstrated that nurses are effective in empowerment people to do self-care or self-management, and in supporting individuals who are at risk and being diagnosed of NCD to change the lifestyle and behavior and administering NCD management programs. However, it is arguable that current nursing education and service systems have not timely adapted and well prepared to effectively handle the NCD epidemiology transition. Nursing systems that support NCD management is to be redesigned, and competencies and capacity of nurse in health promotion and NCD management and support are to be strengthened. This conference will not only provide you with a platform to learn about the current situation and discuss on issues in nursing education, research, advocacy, and the policy around NCD prevention and control strategy, but also to share best practice for NCD prevention and self-control across the globe. World Health Organization has designated, as you are aware that WHO organization has designated 2020 the International Year of Nurses and Midwives. Let us join hands to celebrate our work, accelerate our contribution to NCD prevention and care, and advocate for increased investment in nursing and midwifery workforce. This conference will also provide an opportunity for everyone to share experience and build friendships among us. I therefore have no doubt in my mind that this conference will give you a worldwide experience. Finally, on behalf of Thailand Nursing and Midwifery Council, I once again welcome all of you to this conference. I hope that besides the anticipated fruitful experience of this conference, you will find time, please find time to enjoy the beauty of Bangkok and to enjoy the elegance of Thai culture and our product. Thank you very much.
For the meaningful welcome address.
President of Thailand Nursing and Midwifery Council, Acting President of Mahidol University, individual representative to Thailand, Chair of Organizing Committee, distinguished guests, ladies and gentlemen, good morning. And thank you, Chair. Thank you, Chair of the Organizing Committee, Dr. Yาใจ, where is he? For your opening reports. On behalf of the University Council, it is my great pleasure and honor to deliver my opening speech at this important gathering today. May I begin by expressing my sincere gratitude towards the Faculty of Nursing, Division of Nursing, Sirat Hospital, and Sirat Nurses Alumni Association, the Royal Patronage of Her Royal Highness, Princess Mother, for dedication on preparation to fight against non-communicable diseases and for success in organizing this international conference on N-nergizing Nursing Profession for NCD Challenges or N3 Nursing Conference. As everyone knows, NCDs are the leading cause of death globally. And one of the major health challenges of the 21st century, it is no exaggeration to say that the NCD crisis is playing out most critically in the world. NCDs constitute a health emergency in high-income countries and low-income countries alike. They carry a huge cost and extends beyond health to trap people in poverty, undermine workforce productivity, and threaten economic prosperity. Changes in food consumption and increasingly sedentary lifestyle have a strong impact on human health and environment, an increased risk of developing NCDs. For over 10 years now, NCDs have become the main cause of death in the world, leading to 16 million premature deaths. The tragedy of NCD is that many are caused by forces beyond our control. Exposure to secondhand smoke, alcohol consumption, cheap food and high sugar, salt and trans fat, build up areas that do not provide physical activity. Nursing has consistently seen as having a central role to play in preventing and controlling NCDs. At this important conference, I urge you to reflect very deeply on such realities and to commit to solutions that promote health, protect people, and prevent avoidable deaths and suffering from NCDs. Such solutions must be grasped and implemented by all arms of government and society, especially by you, who are nursing professionals. We are now together witnessing the opening of the N3 Nursing Conference, which has received generous supports from many partners in Thailand and around the world. The conference has been planned so that participants from academic institutions, hospitals, and other healthcare settings take part in the conference and share their research and experiences. As the President of the University Council, I wish the conference will accomplish all its aim. I wish our participants fruitful discussions full of concrete, practical ideas leading to beneficial outcomes in preventing and controlling non-communicable diseases. Thank you.
Thank you very much, Chancellor of Mahidol University. Thank you very much.
Ladies and gentlemen, now it's time to introduce Thai cohorts with their impressive quotes for NCDs. Let's start with Ministry of Public Health, Department of Disease Control, Division of Non-Communicable Disease, Dr. Thamaporn Pilat, the Representative Director of the Division of Non-Communicable Disease. She has an impressive quote is, know your number, know your risk. Let's together fight NCDs.
And second, Ministry of Public Health, Office of Permanent Secretary Nursing Division, Dr. Saksamon Sisuntisa, Representative Director of Nursing Division. With her impressive quote, let's fight NCD together.
Next, Sigma Theta Tau International Honor, Society of Nursing. Associate Professor Dr. Warapon Shaiwat, the Dean of the Faculty of Nursing, Chulalongkorn University, Vice President of the Untitled Chapter, with an amazing course, NCD's Prevention Control or Sigma Nurse Priority.
And next, from Rama Tripodi School of Nursing, Mahidol University, Associate Professor Dr. Poonsuk Jenhanit Visudnipan, Director of Rama Tripodi School of Nursing. And her impressive quote is, "Nurse is the key success to better NCDs."
Next, the Thai Society of Gerontology and Geriatric Medicine. Associate Professor Dr. Virapon Virodat, the Secretariat of the Thai Society of Gerontology and Geriatric Medicine. She has an amazing course is Save Oldest Adults from NCDs.
And the last Thai cohort from Siriraj Hospital, with the quote, "Learning and sharing together to get rid of NCDs from our world." And we apologize that he couldn't join us today.
Next, we will introduce the foreign cohorts with their course for NCDs. The first, University of Gajah Mada from Indonesia. Dr. Ariana Larissa Putri Pertiwi, the representative dean of School of Nursing, Faculty of Medicine, Public Health and Nursing, with the course, "We will stand by you to beat NCDs."
And next, the University of Hong Kong, Professor Dr. Chen Chin Lin, Head of School of Nursing, Lik Ta Chen, Faculty of Medicine, with the third, Vision to Lead, Mission to Serve.
Next, the Hong Kong Polytechnic University from Hong Kong. Professor Dr. Alex Molatiotis, the Director of School of Nursing, with the course, "NCDs are a crisis that belongs to all of us. Time to make noise. Our health, our right now."
And next, University of Illinois at Chicago from United States of America, Professor Dr. Terry Weaver, Dean of College of Nursing, with the course, "Nurses are optimally positioned to lead NCD's reduction and establish a network for research and evidence-based care."
Next, Universitas Indonesia from Indonesia. Dr. Adi Rekawati, the representative dean of the Faculty of Nursing, with the course, 2020 nurses lead the fight against NCDs.
And next, from Johns Hopkins University, from United States of America, Professor Dr. Patricia Jameson, Dean of School of Nursing, with the quote, 2020, the year of the nurse and midwife, is the time to confirm our commitment to a life course approach to address NCD.
Next, Kyushu University from Japan. Professor Dr. Akiko Shisaki, Dean of Department of Health Sciences, Faculty of Medical Sciences, with the course Let's Energize Aging Society and Create Healthy Life Work for Living Financial Power.
And next, University of Michigan from United States of America, Professor Dr. Jody Rowling, Representative Dean of School of Nursing, with the quote, mobilize and invest in nurses to combat NCD.
Next, National Cheng Kung University from Taiwan, Professor Wang Jingji, the representative dean of Department of Nursing, College of Medicine, with the course Advances in Care Demands and Quality of Life through Interprofessional Research and Collaboration for NCDs.
And next, Oregon Health and Science University from United States of America, Associate Professor Dr. Clara Hagen, Representative Dean of School of Nursing, with the impressive quote, facing the multi-level challenge of NCDs together with our communities.
Next, Osaka Prefecture University from Japan, Dr. Akiko Morimoto, the representative dean of School of Nursing, with the course Start to Stop NCDs and Start to Have Better Health Outcomes.
And next, University of Pennsylvania from United States of America, Professor Dr. Antonia Villarreal, Dean of School of Nursing, with the quote, nurses have the capacity and the trust of communities to lead and create a world free of the avoidable burden of NCDs.
And the last Korean co-host, Shuji University from Taiwan, Professor Kai Su-peng, Director of Department of Nursing, College of Medicine, empowering patients with good habits and green life to lead NCDs. The SDGs is action at Shuji University, Shuji Nursing.
Ladies and gentlemen, that are all co-hosts with that impressive quote. Please let's give them great appreciation. To NCD to make this conference possible.
Ready. 1, 2, 3. One beat.
And again in this conference,
Okay, 1, 2, 3.
we also have participants from the camera. Thank you so much for all of you.
Most recently, Dr. Curtis was the WHO representative in Mozambique from 2012 to 2016. During this period, he was deployed to serve as the WHO representative in Sierra Leone to lead the WHO Ebola response activity within the country. From July to December 2015, he was seconded to the WHO headquarters to serve as the director of the project team, working on reform of the WHO work in emergencies. Dr. Curtis began his WHO career in Mali, where he was responsible for polio eradication activities and expanded program on immunizations. He continued this work as the immunization team leader with the WHO, and then as the WHO representative in Guinea-Bissau and Ghana. Prior to join the WHO, Dr. Curtis was Chief of the Division of Respiratory Diseases at Health Canada. Dr. Curtis is a medical doctor specialized in internal medicine and infectious diseases. He holds a master's degree in epidemiology from London School of Hygiene and Tropical Medicine, and is a fellow of Royal College of Physicians and Surgeons of Canada. Honored guests, ladies and gentlemen, without further ado, please join me in welcoming Dr. Daniel Curtis.
As was said, my name is Daniel Curtis. I'm the WHO representative here in Thailand. And I'd like to begin by thanking all of the hosts and co-hosts for inviting WHO to speak at this really important conference. The nations of the world, through the World Health Assembly, have designated 2020 as the International Year of the Nurse and Midwife. We join other partners in a year-long effort to celebrate the work of nurses and midwives, highlighting often challenging conditions that they face, and advocating for increased investments in the nursing and midwifery workforce. As such, it's a great honor for me to be here today. I always like to begin my presentation by telling people where I'm going to end. So if you have other things you want to do in the next 30 minutes, check your Instagram accounts, some email, just pay attention for the next minute and a half. You'll be set. Really, I want to give you 5 take-home messages. And the first is that, in fact, yes, we do face a worsening pandemic of NCDs with significant social and economic costs. NCDs are the #1 killer in Thailand and around the world, and many of these deaths are preventable. We must focus on 4 modifiable risk factors, and I'll talk about those during the presentation. The health sector alone cannot prevent and control NCDs. And finally, nursing professionals play an absolutely critical role in the prevention and control of NCDs by being role models, advocates, and champions. So as public health professionals, as health professionals, many of us involved in clinical practice or in specific areas of public health, we're sometimes not aware of the big picture, the so-called megatrends that influence health. Certainly the rise of NCDs is such a megatrend, and I'll be discussing that over the next few minutes. There are also important demographic changes that contribute to NCDs. Aging certainly, but also urbanization and modernization. These come with changes in lifestyle that put people at risk for non-communicable diseases. And there are policy and system changes. The concept of universal health coverage, the idea that a full range of quality health services should be available to all at an affordable price. And of course, very relevant to this forum, the idea of multidisciplinary and coordinated health delivery. These megatrends will change the way we work and live, so we must be aware of them. So turning to NCDs, it's really important to define what they are. Also known as chronic diseases, non-communicable diseases tend to be of long duration and are the result of a combination of genetic, physiologic, environmental, and behavioral factors. The main types of NCDs are cardiovascular diseases like heart disease and stroke, cancers, chronic respiratory diseases like emphysema, asthma, and diabetes. I see a very young crowd in front of me, so I may not be correct when I say that many of you may have had personal experience with one of these non-communicable diseases. However, I am certain that everyone in this room has a loved one, a relative, or a friend who has died, speaking, and given present trends. Communicable diseases, non-communicable diseases, are likely to kill 3 out of every 4 people every year in Thailand killed by non-communicable diseases. And often we talk about a tsunami, a wave, and this slide shows due to NCDs in blue has been increasing steadily since 1990, and this trend continues. This is due to many factors, but NCDs are becoming a bigger concern because we have been able, in part, because we have been able to control communicable diseases. As you can see here, the proportion of mortality related to infectious diseases, that is the red, cardiovascular disease, cancer, chronic respiratory disease, and diabetes. Around the world, cardiovascular disease is the #1 killer. Ischemic heart disease and stroke account for nearly 1 out of every 3 NCD deaths. Every year, 124,000 people die of heart disease. This graph shows the wave, the bulge, of people getting older in Thailand. It shows the increasing proportion of older people in Thailand from 1970 to what we expect in 2030. More here are significant contributing factors to longevity. And I think it's a very good point. I'll take that back to my regional office, but I think sleep is a really critical, it's a critical lack of sleep, chronic lack of sleep is a very critical, even acute lack of sleep is a critical risk factor for developing disease. Absolutely. Points well. To change human behavior once human behavior and habits are established. That's why we think it's so important to focus on young people. And what I didn't mention in my presentation, but was up on the slides, we need ministries of education and we need educators to be involved in transmitting important messages.
Let me give you a little bit a short bio of her. Dr. Kathleen Protenpa is an internationally recognized leader in nursing, education, and science, as well as the integration of education, practice, and research in clinical settings. Welcoming Professor Kathleen Protenpa.
Thank Team Rajai for organizing this and for so many universities for hosting this event. To be here to make a presentation to you in this wonderful conference. I want to focus on is focus. I would like to recognize my co-authors of this paper, recognizing that this work goes back and has been supported for many years by the National Institutes of Health. But our current work includes Dr. Rob Stevenson from Michigan, Dr. Benjaporn from the Ministry of Public Health Thailand, Dr. Narasol Singadong from University of Technology, Dr. Aaron Cayley from University of Michigan, and Dr. Furston. I also want to recognize that this legacy of work that goes back over a decade now includes Dr. Deborah Barton from the University of Michigan, who was a co-investigator, and Dr. Antonia Villarreal from the University of Pennsylvania, who was an early collaborator with us on this work. Here's just a brief indication of the contents. We're going to talk a little bit about Global Health 2035. There's been a great emphasis on managing the great public health issues that lead. What a tsunami is coming toward us with chronic disease, but I want to say we've done much in communicable disease and much in lowering infant mortality, and that should give us hope that we can do similar things if we work together around chronic or non-communicable disease. So I'm going to talk about the domain challenges before us, including continuing to keep our eye on the ball for communicable disease, what we call the grand convergence that is leading us to very close proximity of nations in managing and reducing infant mortality and communicable disease. And I want to talk about systems for non-communicable disease, really being careful not to overemphasize the acute care management of disease and start losing their focus on population health. because we need both. And then I'll talk a little bit about future concerns and then what we're doing to build research and workforce capacity. So my proposal is that while we may have to be expanding some of our investments in the acute and chronic care of non-communicable disease, we cannot stop focusing in on population risk management and population health. It takes both. And I think some lessons from our country in the US is that as we expanded in the 1900s, latter part of the 1900s, to expand hospital-based care, and certainly into the 2000s, we tended to divest more than we should in public health and population health. And I think we are now trying to learn from that and ramp up, but we have lost a lot of time. So the global goal for prevention and reduction in NCDs is reduction of death rate per year in the escalating diseases. And they are heart disease, stroke, diabetes, cancer, respiratory diseases, and dementias, which are emerging in many countries with AIDS, to support that, as well as individual preparedness. So the health system is looking at both public health targets with policies that are important for the communities down to that level, not just grand policy, but community-based policy, community systems that support health, as well as health maintenance and recovery of their community members. And workforce development, I'm going to talk about that to support the spectrum of needs in non-communicable disease. And chronic care management, to keep people as well as possible, even as non-communicable diseases emerge.
Then we will give opportunities to the audiences for asking questions at the end of the presentation. And we have the microphones at the middle of your tables, so you may want to walk a little bit to ask questions. At this time, I would like to invite our...
It's my pleasure to introduce the first speaker, Professor Dr. Asantashai. Dr. Asantashai is a Deputy Dean for the Faculty of Medicine, Sirat Capital, Melbourne University. He is also the chair of the Asia and Oceania International Association of Gerontology and Genetics. And he also is the president of Thai Society of Gerontology and Genetics. Dr. Asantashai received a medical degree with the second class honor from Faculty of Medicine, Sirat Capital, for the postgraduate training. He was a honorary senior health officer at Departments of Care of the Elderly and honorary clinical research.
A resident certificate in medicine and cardiology, and Doctor of Philosophy degree from Kyushu University. In addition, she was a research fellow at the Department of Medicine at Mayo Clinic, Rochester, Minnesota, United States of America. Her major research fields include clinical research of arrhythmia, electrophysiology, and autonomic regulation of heart, thermal therapy.
In the world, what about the next 10 years? You can see, again, the majority of the world will be older people now, about nearly 30%, except some part of Europe and in Japan. But what about in the year 2050? You can see here, some countries like Japan, China, most of Europe, and you can see here, including Thailand. The number of people will be much more than 30%. That means 1/3 of the population will be older people. So, what's next? You can see the world admires the secret of Asian longevity. Asian people live longer, healthier, and happier. But you can see in this the record, the data from the World Population Estimate in year 2017, among the 5 continents of the world, Asia ranked the first about the percentage increase of older people aged 65 years old or more between the year 2015 and 2020. Which part of Asia? You see, Central Asia top the rank, followed by East Asia and Southeast Asia. This very nice picture show us that the expected trend in aging in Asia in the year 2050, yeah, compared to those in Europe between the year 1950 and the year 2000. The change occurred over 50 years in the West are compressed into just 20 to 30 years in Asia. But the bad news is the older people in Asia will get retired before they get rich. You see? Because the aging occurs more rapidly than economic growth, so it's a real challenge to do the healthcare channel like us. We look into the burden of the disease among older people. This is the diary or this life years. Top of the rank is cerebrovascular disorder, followed by cancer, followed by respiratory disease, musculoskeletal disease, autoimmune disease. You can see all these top 5 are NCD. What about citizens in Thailand? I show you two national exam survey in Thailand. The dark brown done in 2003 and the light brown done in 2008. You can see hypertension has been decreasing in Thailand. It's good news for us. Maybe we have the effective public campaign. But what about diabetes, lipid disorder, stroke, COPD, CKD? They have increased. This is a daunting data for the health policy maker in Thailand. Because if we just sitting, we don't do enough. We just coping with the daily practice. In the near future, the health personnel will be very heavy burden to their daily practice. Right. And the next one, I will show you that some people is not a typical person. Some are very active like this, but some are lying in bed sick. So they are heterogeneous. So what are the unique features of old people? I'll show you this, the mnemonic of RAMPS. Which is R stands for reduced body reserve. A, typical presentation. M, molecularity. P, polypharmacy. And S, social adversity. These are the unique features of older patients. So how can we adopt this concept into our care to NCD? You can see this is some of my research show that muscle strength of older people decreasing over the years. From the first, second to third year, the solid line represents male and the dotted line is female. You can see we don't do anything, but the muscle strength will decline on their own. What about the blood glucose? The blue one represents the postprandial glucose. That means we check blood glucose after 2 hours of meal, and fasting blood glucose is about 6 to 8 hours fasting. And you can see as we getting older and older, the level of postprandial glucose will increase higher and higher. So it's no doubt that we represent the prevalence of type 2 diabetes. You can see the prevalence increase with time as years go up. You can see. So it's like the upside down of the water. So that's why older people tend to suffer from diabetes. That is reduced body reserve. And what about the typical presentation? Some people may come to see us with the fall, immobility, interest impairment, liability, incontinence, insomnia, inanition, or anorexia, and androgenesis. These are some common clinical manifestation of for people with NCD. They will come to see us with all these symptoms. So as we are all healthcare personnel, we have to be familiar with these symptoms because in the past, if people come to see us with the polyuria, polydipsia, and weight loss, you may think about diabetes straight away. But for people with diabetes, they have to see us with form, not polydipsia, polyuria, something like that. And pharmacology. These are the study in Thailand about the daily, the top 10 on this side is male, on this side is female. You can see the top 4 of the rank of the disease that create the highest daily among Thailand, which is cerebrovascular disorder, diabetes, ischemic heart disease, and dementia. And all these diseases also rank one of the top 10 among them. What about the other COPD, cataracts, and the deafness? You can see all of these this is the pathology that people may have something like this at the same time. But concerning the common chronic diseases among older patients, I can show you some 3 common groups. The first one is musculoskeletal disorder, like osteoarthritis, gout or pseudo-gout, osteoporosis. And other ones are general medical problems like hypertension, diabetes, dyslipidemia, chronic heart disease, stroke, and infusion. And the next one, the last one is neuro disorder like Parkinson's disease, dementia, or depression. So we have to be aware that any patient comes to see us with some NCD, like hypertension, diabetes, they may have all of these at the same time. You can see all of these, nearly all of them are NCD. So what about the neglected one, the neglected NCD, something like osteoporosis? You can see osteoporosis can make the people walking straight like this, maybe stooping feature like this. And we look into the annual incidence of osteoporotic fracture. It outnumber the number of heart attack or even stroke. It's more common than what we tend to be familiar with. And the other one is my study. I measure the bone mass by the QS or protein ultrasound. And in men, you see, in those who have a reduced bone mass, they perform much poorer in terms of activity of daily living, significantly. Also the same as in women. What about the other neglected NCD? Undernutrition is quite commonly to be neglected. This picture shows us about the some particular pathway of the homocysteine. So these are the situation that has been neglected from our practice. So we have to be careful about undernutrition as well. We talk about NCD. What about the figure in Thailand? This represents the survey in Thailand about information of Thailand. It shows that even in Thai food law, it should be less than 7.5, not 7.9, as it is used in general town. What about what people with moderate morbidity, such as poor ADL? The target of A1C should be less than 8.9. And what about those who suffer from severe morbidity, such as dementia or really frailty? The A1C should be less than 8.5. You see, the target is quite different from the young adult. What about the blood pressure? In those with severe morbidity should be about 150, not 140 like in young adult. So we have to be aware of the target of the treatment of NCD. So it's really important that we have to adopt the CCA, physical assessment, mental assessment, social and functional assessment to care for the people with NCD. These are some examples of tools that we can use in our daily practice. Like we use the ADL to assess the disability, we use the classification scale to assess the patient. For we can use the N-nergizing test. We use the questionnaire to screen for incontinence, or even we do the medical examination, right, MSD. And modification, we can use many tools like mini nutrition assessment or MMA, or subjective flow assessment or SBA. So these are some useful things that we should do. Now, another thing which is really important when we care for people with NCD, because of the infectious disease is also common among people with NCD as well. These are the guidelines that should be less than 7.5, not 7.0, as it is used in general town. What about for people with moderate morbidity, such as poor ADL? The target of A1C should be less than 8.0. And what about those who suffer from severe morbidity, such as dementia or really frailty? The A1C should be less than 8.5. You see, the target is quite different from the young adult. What about the blood pressure? In those with severe morbidity should be about 150, not 140 like in young adult. So we have to be aware of the target of the treatment of NCD. So it's really important that we have to adopt the CCA, physical assessment, mental assessment, social and functional assessment to care for the people with NCD. These are some examples of tools that we can use in our daily practice. Like we use the ADL to assess the disability, we use the depression scale to assess the depression. For we can use the N-nergizing test. We use the questionnaire to screen for incontinence, or even we do the medical examination, right, MSD. And modification, we can use many tools like mini nutrition assessment or MMA, or subjective flow assessment or SBA. So these are some useful things that we should do. Now, another thing which is really important when we care for people with NCD, because of the infectious disease is also common among people with NCD as well. These are the guidelines that the older people who suffer from diabetes, they should also receive vaccination for flu vaccine, Tdap, shingles, pneumococcal vaccine, and both those who suffer from CKD, like this, kidney disease, you see. So there are common comorbidities in every people as well. So although we talk about NCD treatment, don't forget vaccination. Otherwise, they will survive from the NCD, but they will suffer from disability of premature death from infectious disease. So that means if we have to adopt the concept of NPS, we need the team to be complete, to be composed of nurse, social worker, physical therapist, occupational therapist, dietitian, pharmacist, dentist, doctor, with the patient at the center. So which we call multidisciplinary and integrative medicine. Then we have to adopt this. So that's why WHO has proposed the concept of healthy aging in the year 2050. That in the decade of this year, toward 2030, should be a decade of healthy aging. And how to achieve that? The WHO proposed that we should align health system also the needs of the people. We cannot just hang on with our current system. We have to create something like this, which is the age-friendly healthcare system, and also the long-term care system, the age-friendly environment, and to improve the measurement and monitoring. So these are all for measurement. So that's why the world desperately needs a special health service for NCD, for all people with NCD. It is clinic and how to do that. So I'll briefly show you in this column show you the main practice. And this graph shows the desirable characteristic, and this one is the outcome. Because at the moment, healthcare personnel cannot differentiate or not aware of the age change and the disease. But in the clinic, the well-trained personnel will know all this, and outcomes would be the health promotion. And the passive healthcare should be active healthcare by the discipline. What about differentiation? Healthcare personnel at the moment are not familiar.
In this presentation, I would like to focus on the policy related to NCD control and care in Taiwan. Taiwan had just entered the society of age in last year, 2018, and the population will reach to, the elderly population will reach 20% in 2025, which would lead Taiwan to become a super aged society. And in 2060, Taiwan will become a super aged society. So the care for the elderly population is very critical. And this slide shows the first leading cause of death in Taiwan. And we could see from the table, cancer has become the first leading cause of death in Taiwan, which kills a lot of people each year. And it has been, for the past 30 years, cancer has remained the top killer for Taiwanese people, while heart disease was the second leading cause of death of the world. But Taiwanese government had great effort to pursue the NCD control, and we wish to reach the ambitious goal of decreasing the global mortality NCD. Although Taiwan is not a member of WHO, we support WHO's Global Action Plan for Prevention and Control of NCD from 2013 to 20. And Taiwan provides evidence-based prevention health service, including health examinations, screening, smoking cessation, and supports the construction of the sites of health promotion like schools, the workplace, the military, hospitals, and clinics, and the community and cities. We also actively preventing the 4 major risk factors of NCD, which was presented this morning, including tobacco use, unhealthy diet, lack of exercise, and unhealthy diet. The Health Promotion Administration, HPA, or Ministry of Health and Welfare in Taiwan, has been implemented the smart eating, healthy moving, daily weighting campaign to prevent obesity for many years, and we have impressive outcomes. In regard to tobacco use control, Taiwan has further expanded smoking ban on April 1st, 2014. Smoking in public areas in Taiwan became illegal. In regard to alcohol harm prevention, Taiwan implemented a zero tolerance policy for drinking and driving on June 13, 2013. And we also reached successful outcome. I would like to introduce 3 departments under Ministry of Health and Welfare in Taiwan, which has great role in controlling NCD and care for people with NCD. They are Department of Health Promotion Administration, I call HPA. And the second one is the Department of National Health Insurance. The third one is the Department of Long-Term Care Plan, version 2. So if I say policy, including monitor tobacco use and prevention policies, and protect people from tobacco smoke, offer help to quit tobacco use, warn about dangers of tobacco, like secondhand smoking, and enforce bans on tobacco and raise taxes. Most of the fund for our long-term care plan is from the tobacco tax current in Thailand. And this is about the policy for aging and chronic diseases control. The government provides preventive health care service for adults including physical examination, blood and urine tests, and health consultations. And for the integrated screening services, in order to provide comprehensive on-site screening in local communities, the HPA has been encouraging counties and cities governments to consolidate their medical resources since 2002. This included integrating screening already used in adult preventive health care services and cancer detection. And due to the increasing prevalence of chronic disease in Taiwan, the HPA also has set metabolic symptoms, diabetes, cardiovascular disease, and kidney disease, amongst others, as a preventive cause of chronic diseases in Taiwan. Because cancer has, as I presented earlier, that because cancer has been the first leading cause of death for 30 years in Taiwan. To fight cancer, Taiwan Cancer Control Act was promulgated in 2003. And equal the act, we have 4 phases to control for cancer. And now it's 2020, we have entered the 4th phase. And this slide shows the 4 cancer screening in Taiwan.
Causes of death, NCDs, and the present status of the elderly people. And in part 2, I'll introduce health status, health checkup system in Japan. Lastly, in part 3, I'll introduce our research activities for resolving such problems in the life expectancy in the world, very low in African countries and high in Europe and Japan. In Japan, around 70 years ago, the life expectancy was very low, especially due to World War II, and we said era of 50 years lifespan. But it rapidly elongated to the top of the world now, and say era of 90 years. However, as well as other Asian countries, aging is advancing, and Japan precedes all other countries. And in 2055, total population will decrease, and about 40% of the population will be more than 65 years old. Now, let's see the causes of death in the world. The most dominant cause is the cardiovascular diseases, and next is cancer. Respiratory diseases, dementia, digestive disease, neonatal disorders, and diabetes are following. In Japan, the highest cause of death is cancer. Next is heart disease, and pneumonia, and stroke follow. Death rate by stroke are extremely decreasing due to preventive activities by public health service. Death ratio of heart diseases in Japan are changing. Left panel is growth rate and right panel is age-adjusted. Age-adjusted rate of total heart diseases is decreasing. However, due to aging population, growth death rate by heart disease is increasing. by increase of death risk by public health activities, and death rate of stroke are decreasing. But prevalence of hypertension is still increasing. The increase of dyslipidemia, diabetes, and obesity are in the same tendency. Prevention of NCDs, and in result, we can reduce the healthcare needs and medical expenses. We have mainly two types of health check-up systems. One is general health check-up systems for all adult workers, and another is school physical and dental health examination from elementary schools to colleges. In general health checkup systems, the targets are all adults. Employees have legal obligation to offer annual free health screenings to their employees. And freelancers and small business owners, health checkup services are set up by local city offices. Checkup entails include these basic items shown here. Benefits of these systems are the effective early detection and prevalence of NCDs, and to give the nation the closer attention to their health. For children during compulsory education from elementary to middle school, government offers their health checkup. Health checkup entails include physical and dental examination. In high schools and colleges, almost all institutes have done the health checkup systems and under the support of government. Last part, I'd like to introduce our research projects in nursing department in Kyushu University. Firstly, delivery of the health checkup system in Asian country. We call portable health clinic services. In 30 by 50 centimeter attaches, basic items and PC computer are set up. Even women like me can carry it. After the examination in even rural area, the examinees can immediately receive their results. There are a total of 25 health checkup items, including body measurements, blood pressure, blood tests, urine tests, and eye checkup. These pictures show the steps of PHC checkup in more than 1,200 people have received PHC checkup in India since 2016. Let's move to another activity of my department. It's undernutrition in women and small babies related to NCDs. In Japan, over the past 50 years, perinatal health of mothers and babies have been improved, but high-risk pregnancy are increasing. The number of births has decreased by 50%. The maternal death rate has decreased about 180. The neonatal death rate has decreased about 140, but the preterm birth rate is increasing, and the number of low birth weight infants has also increased. The number of older pregnancy women has approximately doubled. We have faced the potential risks by birth with fetal growth defects. Because perinatal mortalities and morbidities rate are increasing, strict perinatal management is required, and the rate of cesarean section also increased.
NCDs is in aging increase and improve the number of morbidity and mortality. One elderly person usually not only suffer from one disease, but also mortality, complication from that disease. And we also know that there are a lot of evidence from the result of the research to deal with. But the problem still remain and will not over.
At the beginning, the government allocate some money to start that. It's about let's say it's about 600 million baht, and increasing a bit by bit. But we have some problems that because of the regulation of the use of money in the communities. That's why this system is not going well in Thailand now. But mainly the concept is because Thailand is not a very rich country like in Japan or in Taiwan. So we tend to rely on the healthcare volunteer. The healthcare, you have heard about the user coverage. It's quite a very effective system in Thailand. So that's why we use the health volunteer to do that. And at the moment, the government try to provide some money, let's say about 5,000 baht for the healthcare volunteer. Look after about 10 families who need long-term care system. So far, Thailand has been developed up to that point. But I think in the near future, suppose that we are lucky, we get richer. Perhaps government will allocate some money to do that. But I think in my perspective, I think because we are in the Southeast Asian country, people, even in Japan and in Taiwan, focus more on health promotion. How to do the screening check-up, how to attack first. Don't let them suffer from complications. Otherwise, we will be overwhelmed with too much health expenditure. That's why my answer. I hope answer your question.
So it is very interesting presentation, and I'm really curious about polypharmacy problem, and we do have this problem. My question is how we can optimize the nurse role and this kind of thing, because doctor plays a very important role in this kind of problems. And do you think by suggesting some traditional medicine, for instance, will be effective for the elderly patient or not? And my second question is for Prof. Wang. I really noted your tagline, happy exercise and smart eating, happy exercise and our daily waiting. It's very impressive. My question is, because all of young people, they will get old. So do you have, in Taiwan, do you have any special program for young generation to prepare a healthy lifestyle, healthy aging in their future? So thank you so much.
For a question from Lisa, my student. This is a good question. And for young people, for those youth, I think there are a lot of exercise programs in school, from elementary to college. And but for those maybe graduating from school, for those young people, I don't think we have any for exercise promotion program especially set up for them. But for middle age and for those pre-disease like early sign of dementia or those who has hypertension, who has higher level of blood glucose, has not yet diagnosed as diabetes. We do have this kind of program. The health promotion program to decrease the decline from disability from under the long-term care plan version 2 in Taiwan, and we set up this kind of program in each county, and the national long-term care plan under the Ministry of Health and Welfare, they have this portion of money and allocate to each county. And so the county will call for proposals, and communities or maybe clinics or hospital or even university, they could apply for such kind of health promotion program. and to get reimbursement from the long-term care plan and to set up this kind of program. And so those who have needs sign up for free and to exercise. And for it's really worrisome that young people in Taiwan, they just like Japanese, they eat unhealthy, and they like to have like high calorie, high sugar free, and they like Western food. I don't mean Western food is not healthy, but young people, they really love to go to eat McDonald's and to have fried chicken, something like that. And so that's worrisome. So we will think about to have more healthy food.
Lisa, I'm happy with this answer. I'm happy. Alright? Where you come from? Indonesia, right? Why I ask this question? Because I agree with you totally that you mentioned about the polypharmacy suffer a lot for the whole our region. Why? Because the medicine for old people or genetic medicine is hardly practiced in our Southeast Asian country. I know Professor Siti Sitiati, who is the president of the Association of Genetic Medicine. At the moment, as far as I know, less than 100 physicians in Indonesia. Less than 100. But your country is more than 700 billion, something like that. At the moment, I think it's a huge country. So that's why we need district clinic now. That's why I told you in my slide. The world desperately needs district clinic. The clinic that the operation has a holistic approach. We can afford that people come to see very specific clinics. Let's say if they have some 10 diseases, let's go to 10 clinics. Then we end up with so many medicines high up and you see the picture. So as a nurse, how can you help this patient? It's right, the patient. As a nurse, how to help that? I think first start, you should go to some list of the medication that easily clear the adverse drug patient for all people. I haven't mentioned about the BS criteria. Have you heard about that? BERS criteria. BERS criteria. You go to Google and you search with them. Create a good list of the medicine that commonly can do harm to all people. So as a nurse, if you family with that list, let's say you see the patient with some polyuria, and because of they suffer from dry mouth, so they didn't the amount. That's why it causes polyuria. And you know that in the list, the doctor prescribed something such as anti-creative drug that can create the dry mouth. So you follow me? So you can present to doctor. Our patient has got something like some problem. They didn't a lot because of the dry mouth, and our patients get this medicine. So please consider. You see, if there's some small things the nurse can do to decrease that problem. And the thing is, you see, in IPD, in the patient in the ward, some patients stay in the ward maybe 3 or 4 months. And you can see the doctor just write the prescription on the front page. But perhaps maybe the new doctor, they forget to see at the bottom of the prescription paper. So you should try to do some treatment review. Every time a new doctor comes to your ward, you review the treatment. Doctor can see, oh, I don't know that my patient has got this medicine. I don't know that, something like this. So as a nurse, you can help to decrease this problem. So, are you happy with my question? My answer.
For your recommendation, I'm a student in Japan. So I have a question to Professor Wang. In Thai, you say in your presentation in Taiwan, the mental institution engaging, right? two questions about that. First is, who is the main worker in that institution? And second is it problem of the shortage of human resources? And if there is, how to control that shortage of human resources?
You mean who is the main worker working in institution to take care of patients with dementia? Okay. Actually, it also relate to the second question, human resources. We really face this kind of big problems. I'm not sure if Japan is facing this kind of issue. But in Taiwan, since the long-term care plan started, our government is now putting a lot of effort to train a lot of caretakers who could work at home or in the long-term care institutions to take care of patients with dementia. I think there are a lot of people receive the training, but maybe only a half of them really work and care for patients and pay to be a caretaker. And for dementia care, because it's another specialty, and that people need to receive like 40 hours, 20 hours dementia-related education, and to receive a certificate first. And then if they want to go for advanced care, they have to receive another 20 hours. That the educational program to prepare for those who could be capable of taking care of patients with dementia is okay now, it's good, but still we are seeking, we are waiting for those trainers who could return to take care of them. So that's another big problem. Thank you for mentioning. Maybe I want to know the experience from Japan.
In Japan, the same program we have caretakers that have some license due to the exam after the examination, but it's not a national license, so the salary of a caretaker is very low comparing to nurse. So many people don't like to become caretakers. So we need same resolve to this same problem in Japan too.
And one of the program is how the family taking care of the elderly. So in this case, we are culturally trying hard and keeping that the elderly stay at home with us. If we have special needs, then we will have another professional to come for home care. So my question is that, could you share also the experience of the role of nurses in empowering family to take care of the elderly stay at home? Because in Indonesia, there is a values that we fail as a family if we send our elderly, our parents out of home. Thank you.
The experience of home care in Taiwan, we also emphasize aging in place, like what you have been doing in Indonesia. And we provide two kind of services to home care. First one is professional home care, provided by nurse, PT, OT, or other specialties, or also NP. And the other one is home care service provided by caretakers, common people. And so what is the role of nurses? I think nurses play a crucial role for the home care, because nurses is the most frequently professional providers to provide home care in Taiwan, and it depends on the condition of the patients. And we also, I think about 90% of elderly need care at home in Taiwan, and so we need to put more efforts on it.
And also train the family care
Yes, we provide education to the role of nurses not only care for the patient, but we need to train them and educate them. Here they know how to take care of it, and then we end the problem. That can save a lot of money from the national health insurance. But just 2 months ago, I went to the United States, and I'm very impressed about the home care in the United States. So maybe someone here could share the experience in the United States.
Thank you, Dr. Rathi from India. Thank you for the enriching presentations by all the three. This is especially for India. There was a JICA collaboration with the nurses. Nurses were supported by Japan for various these activities, NCDs, and also for community participation and control of non-communicable diseases. Recently, in 2018, in India, there was a step of Ayushman Bharat under health and wellness centers, where nurses are appointed as a community health officer or the middle level provider. That is a new step. So really they require some mentoring as well as hand-holding. How Japan can contribute, the experience of nursing can be extended to the nurses of India. Is there any online or resources, learning resources available? Or through virtual platform, is it possible to guide them or mentor the nurses in India in taking care of all these preventive as well as rehabilitative needs of the elderly? There was collaboration with India and Japan through JICA, where the nurses were supported by the Japan counterparts, especially in taking care of non-communicable diseases, community participation, etc. But over a period of time, recently I am not finding such collaborations in health. And in India, there is a new step which has taken where nurses are appointed as middle-level health provider, and they are taking care of community-based survey as well as taking care of their NCDs. So I'm just asking, is there any way to collaborate or support, mentor these nurses, because this is a new job they are doing, and how you can share your experiences and your expertise. Is there any online platform or virtual learning possible?
Yeah. They educated in Japan in some institution and go back to the India. They have an activity to carry the PHC dash base in rural area, and they check out the residents, and the center of the some city in India, they have connected PC. Some doctors are related to this project, consulted to some results and answer the doctor comments to the results of the health checkups. So the resident in rural area can receive the health checkup immediately. And every year, such caregivers are educated in Kyushu University.
Can you think of having it especially for nurses, year of nursing and midwifery?
They
For
don't have,
nursing,
they don't have any nurse.
I'm Assistant Director General to the Ministry of Health, so I would like to know that the collaboration is possible. I am Assistant Director General to Government of India. I would like to know that any collaboration is possible, especially for nursing, capacity building of nurses in this area.
I can't answer immediately. Sorry.
So Gleason Henry from Oregon Health and Science University. And first I would like to apologize for McDonald's and for our Western food. We also are suffering from it. impact of high fat and high sugar. So I'd say I don't know that I can answer the entire health system for older adults, but I do work with individuals with dementia, and so I think that we share many common challenges with home care and delivery of care within the dementia population. What part of the long-term care setting were you impressed by? I guess you were saying you were impressed by home health when you were in the United States. So what did you see that was impressive to you?
Question to me. I have 2-week practical in the United States in October, and I went out with a registered nurse who sees patients mostly with non-NCD, diabetes, hypertension, and cancer patients. And I saw another advanced equipment be set up at home in the United States because the fee for hospitalization is very expensive in the United States. So I see the home care agency, they reimburse put money to the home care nurse. And the role of the home care nurse is very advanced. They try to teach the family caretakers to learn how to take care of their family sick persons in order to save money, the insurance money and all the Medicare money from it. So I see that maybe in the near future in Taiwan we need to adapt that to decrease the cost from people who are hospitalized.
Yeah, and that's absolutely a push. And I think nurses have been very involved with self-management kind of approaches and self-management supporting families and all of these chronic diseases that, as you mentioned. And I think that we have further to go, and also with our our system as far as who has access to it. Many of your companies or many of your countries are doing a better job than we are about having people that are insured and able to get to the care. So I'm glad that things went well for you, and we also have a lot to learn, all of you too.